Okay, so one of the biggest risk factors we hear about is family history. So if you have a family history of a first-degree relative, mom, dad, brother, sister, child with colon or rectal cancers, either under 50 or over 50, that's a risk factor. If you have a personal history of it, or family history of any genetic syndrome, such as Lynch syndrome, that can increase your risk as well. If you have a personal history of inflammatory bowel disease, Crohn's disease, or ulcerative colitis. If you have a personal history of certain types of cancer, so for example, breast cancer and ovarian cancer, there's been some literature to suggest an associated risk, so we may decide to screen you sooner, depending upon your personal circumstances. Other risk factors include our Western diet. So we know that a diet low in dietary fiber, high in processed foods, ultra-processed foods, red meats, and processed meats can certainly increase your risk. We know that being overweight or obese, leading a sedentary lifestyle, smoking, and heavy alcohol consumption can all increase your risk as well. We do see increased incidence in African Americans and Native Americans, so that can be a risk factor. And then the last thing is there is some association between type 2 diabetes and increased risk for colon and rectal cancers as well. The one thing I want you to know though is that most colon cancers are actually asymptomatic. So, and there's not always, you don't always have to have a family history. So a lot of the patients that we diagnose, they don't have a family history. They run 40 miles a week, so you don't have to have these risk factors in order to develop colon and rectal cancers. So that's why it's so important to get screened and to get your colonoscopy at 45 based on current clinical guidelines when you don't have any symptoms, so that we can identify things early on before your polyp turns into cancer. Yeah, so you can't change your genetics. You can't change who your mom or dad is, or your family history. You can't change if you have inflammatory bowel disease, Crohn's disease, or ulcerative colitis, but you can do certain things, right? You have control over smoking and alcohol, so you can stop smoking. You can minimize your alcohol consumption. You can get active. You don't have to be running on the treadmill for 2 hours every day, but you can get out and go for a walk, and get some brisk exercise, 60 minutes most days of the week. So we know that by being more active, you can change your diet. You can consume more dietary fiber. So we know that a diet that is high in fiber and low in red meats and processed foods helps to prevent not just colon and rectal cancers, but other GI pathology. So eat your fruits and vegetables, and limit the red meats. You don't have to follow you don't have to not eat meat. You can have red meat here and now, once a week. You can still have the benefits of a whole food plant-based diet by consuming, red meat here and now. But for the most part, try to eat more of a whole food plant-based Mediterranean style diet. Eat more beans, legumes, fruits, vegetables, limit those processed foods. All these granola bars that I have in my pocket, you want to steer clear of, and just, get active and cut back on the bad habits.